This conference will now be recorded.
Hi, everyone. My name is Jorge, and I'm with Doctors for Change. I'm the program manager there, and I'm here to introduce our speaker today to help give us more information about the upcoming MAT Waiver Training opportunity. So, Dr. Kowalchuk, please introduce yourself and let us know what today is about.
Sure. My name's Alicia, Dr. Kowalchuk, and I'm an associate professor at Baylor College of Medicine. I'm boarded in both family medicine and addiction medicine. And we're going to chat today about the opioid epidemic and what you can do as a healthcare provider to help treat patients with opiate use disorder right in your own practice. Currently, we have a lack of treatment availability and a huge need for treatment in our community. And I have an upcoming training coming up on September 18th, and want to encourage folks to try that out.
Thank you. Absolutely. So today's goal is to really do three things. Number one, talk a little bit more about the MAT Waiver Training, what that looks like. Number two, help answer any questions along with that. So if our guests who are online, if you have any questions, we're going to help answer those questions at the end of the presentation. And number three, we're going to also discuss the importance of this. Why are we doing this? Why are we having this meeting today to try to combat this epidemic going on with the opioid misuse? So what I'll do is I'm going to go ahead and pass the mic on. What I'm going to do is switch over to the next window, and then I'll share my keyboard and mouse access to you, Dr. Kowalchuk.
Thank you.
That way you'll be able to switch the slides.
Okay.
All right, so give me a second again. All right, and how does my screen look like? Does that look good there? Or is it hard to read? Let me swap it.
Yeah.
Is that better?
Uh-huh.
Perfect. So let me know if you have access to keyboard and mouse. If not, I'll try to troubleshoot it.
Okay. Well, I wanted to start by just detailing a little bit about opioids in Houston in particular. So, where are we at with the opioid epidemic in conjunction with the COVID-19 pandemic that we're dealing with? And this is some early data in that overlap of the two pandemics. And next slide, please. I don't think I have control.
I try to click, and I think it's going to work. There it goes.
Okay, there we go.
Perfect.
So data from UT Health Sciences has shown that we have an opioid related death every 32 hours in Houston. And we see that opioid related death rates continue to rise in Texas and across the country. HPD and HFD receive between 50 to 100 reports of opioid overdose every month in our community. And of those, about one out of every 3 to 4 are fatal. So this is a big issue in our community in terms of morbidity and mortality. So what we want to do is try to interrupt this cycle and keep people alive through their overdose, and then also link them into appropriate treatment. And that's where we need more of the medical community to step up and step forward, get trained to be able to provide treatment for opiate use disorder in their practices, and get some support to do that, to start that treatment. Okay. So again, let's just review a little bit about where we are. So I work with two grant-funded programs, Frontlines and Heroes, that help to intervene when someone's had an overdose and HFD has responded to their overdose. Frontlines sends health workers right into the hospital ERs to intervene and interact with the person who's just had an overdose experience, trying to link them into care, getting them opioid overdose prevention medication, naloxone. So if they do go back out there and use again, they are less likely to have another overdose. And HEROES responds after the person has gone home a couple days later and sends again a counselor, a person who's in recovery, to go and meet with the person where they are in their own home, wherever they can find them, and again offer them support and linkages into care. And so we've seen an increase in opioid overdoses across the greater Houston area through both those programs and HFD's own data. Okay. Right, and you can see that here. So this was actually just for the first quarter of 2020. I'm still waiting on second quarter data. And you can see we saw a 31% increase in overdose incidents in our community in just the first quarter compared to the first quarters of 2018 and 2019. And so that's only about a month worth of that data is overlapping with the pandemic, and we already see a big increase. So we're anticipating second quarter data is going to be much higher. We're also seeing that most overdoses in our area are not just to opioids, they involve polysubstance use. And so we often find opioids in someone's system after an overdose, along with things like benzodiazepines, like Xanax, Valium, muscle relaxants like carisoprodol or Soma, and other substances. So you can see the frequency by drug or group between for all of 2019 and what was identified in Houston by the medical examiner. These are opiate overdose cases. And you can see we also see a lot of stimulants involved in overdoses. So methamphetamine and cocaine are huge as well. We see opioids, including heroin, non-opioid pharmaceuticals here, synthetic cannabis, PCP, bath salts, and miscellaneous. But it's really common to see multiple substances. It's really uncommon to just see one substance. And in terms of what opioids are being detected, we have heroin really predominates, and then fentanyl does have a big presence in our community. Hydrocodones, so those are the narcos, the Vicodins. Oxycodones, a bit less, codeine, and then tramadol. And then lower down for other things like hydromorphone, Dilaudid, etc. And the fentanyl group included all of these different types or related to fentanyl products. So fentanyl itself, carfentanil, which is actually known as an elephant tranquilizer and is much more potent than even fentanyl. And the 6U-47-700, just another fentanyl derivative that's actually more potent than fentanyl as well, falls somewhere in between fentanyl and carfentanil. And then the benzol fentanyl, again, just another analog. Okay, forward. And then in terms of pharmaceutical opioids and other pharmaceuticals, we see alprazolam or Xanax is our #1 benzodiazepine we see involved in overdoses in our community. You can see here the carisoprodol involvement here. Tramadol, which actually is metabolized in the body into an opioid metabolite, so it essentially acts as an opioid in the body. We see the fentanyls, promethazine. We see it a bit here in our community as well, so a variety of substances. We're also working hard through several grant-funded initiatives to increase the amount of Narcan available in our community. But with that, and particularly with the more potent opioids like fentanyl. You know, sometimes it's taking more and more naloxone or Narcan as the branded product to reverse an opioid overdose. So 2, 3, 4 doses in the field is sometimes needed. And even if someone has 1 or 2 of these doses, it's rare that an individual is going to be carrying 4 or 5, which may ultimately be needed, particularly if fentanyl is involved. We're also seeing an increase in the supply, an increase in the price of opioids, particularly prescription opioids and heroin, because of tightening of the borders and the routes of distribution. This is resulting, at least in very early data, in more fentanyl flooding into our community, which is much easier to transport because 2 little grains of salt size worth of fentanyl is basically a lethal dose. So you don't have to ship a bunch of this stuff to cut it up and make a lot of street product. So we're seeing more fentanyl as a result. We're also seeing with the pandemic more relapse. So people that have been in recovery, oftentimes long-term recovery, because of the stress and the isolation associated with the pandemic, we're seeing more people relapse back to their substance use disorder. So the good news, the silver lining in all of this, is that we are seeing an increased number of people report to treatment centers and calling and seeking treatment. We're just not having enough spots for everyone to get the treatment that they need. The community has really been working hard on that response. A lot of treatment centers have switched to virtual meetings and support groups to keep things going during the pandemic and yet keep their communities safe. We do have several programs in the city and the county to help make direct connections to medication-assisted therapy from the jails. Also the HEROES program and Texas Clinic, which is one of our opioid treatment programs in the area. We have an MVP program that's working to help offload people from the emergency centers and connect them to inpatient care. We also have a way home that's helping opioid patients get COVID-19 testing and appropriate quarantining if need be. The HEROES program and Frontlines program had both suspended outreach, direct outreach, but they're back in the field now, so that's good. We have a new state grant impacting Narcan distribution sites in our community. And again, the treatment community, specialized substance use disorder treatment community, is really working hard to keep their doors open for those folks that need residential treatment, don't have an otherwise safe, sober place to be in early recovery. It is challenging, as you can imagine, in a group setting and having a residential treatment center and keeping everybody safe. Our patient populations, our client populations are really high risk for the pandemic. So it has been a challenge, but our treatment community is stepping up. Again, our jails are participating in Narcan or naloxone opioid overdose education and distribution. And the Houston Recovery Center, Sobering Center, is distributing naloxone and offering education to all its clients. So a lot is going on, but we still need your help. And so I wanted to talk a little bit about what that help looks like and what the training is really going to entail. So the training on September 18th is the first 4 hours of an 8-hour training that once you complete it and send a very short bit of information to the DEA, the Drug Enforcement Agency, you will be able to prescribe buprenorphine for the treatment of opiate use disorder in your practice. There is CME associated. Once you complete the 4-hour online training, you will get 4 hours of CME total for the 8-hour of training. The 4-hour in-person must be completed before you get access to the 4-hour online training. So it's a first step and then a second step. The training, we'll talk a lot about how opioids work in the body, about opiate use disorders, and then several of the medications that can be used to treat opiate use disorder, again with the focus on buprenorphine products, because that's something that's relatively easy to incorporate into routine primary care, for example, psychiatric practices, etc. And really well received by patients. Patients get better quickly with the medication, stabilize in their addiction, and just start feeling back to normal. It's really remarkable. And again, we have a lot more patients out there looking for treatment than we have treatment slots available. So we really need community primary care providers, psychiatrists, and others to step up and take on this work because it's beyond the scope of our existing substance use disorder treatment community. And there's many of us in the treatment community and addiction medicine specialists that are here to help guide people implementing this in their practice. So I've been doing buprenorphine treatment for patients in the outpatient ambulatory setting since 2007, so well over a decade, and I'm happy to help folks get started with the work. It's really been one of the most rewarding parts of my practice, again, because the medication works well and patients really go from that rock bottom to a place of hope and resilience and moving forward with their life in amazing ways. And it's really great to play a small part in that. So I encourage everyone to get trained up, come to the training on the 18th. It'll be interesting for sure. And you'll have good support to help you on the rest of the journey from getting trained to getting your waiver, which is they've really made, the DEA has really made it pretty seamless, easy online process and a relatively rapid turnaround. And then really being there and helping you to incorporate this into your practice and get over that small bump of going from not prescribing it in your practice to having some patients that you're caring for with opiate use disorder in your practice. Most practices, you're going to find that you have patients of yours that do have opiate use disorder, and you can start there. But certainly there are a number of treatment providers in the community who are ready and willing and able to partner in a hub-spoke model. Meaning, for example, my work at Santa Maria Hospital, we work to stabilize patients on the buprenorphine products. And then we're happy to transition stable, doing well in recovery patients to community providers, primary healthcare providers, et cetera, so that we have room to take on more patients and get them stable, et cetera. So happy to help connect people in partnership in that way as well. I'll pause now for questions, comments, concerns.
Thank you so much. And we definitely appreciate you taking the time out to talk to us today, Dr. Kowalchuk, about this opportunity. You gave a really good overview and kind of took us a bit of an outlook into what opioid use looks like in Harris County. And really, I think the outlook is really hopeful, especially when we have professionals like you really leading the way and helping address this in our community. So partnerships like this are super important, and we appreciate being a part of it. And I do want to encourage, if anyone is on the line, feel free to unmute yourself and ask any questions at any time. But I do want to also just kind of cover any sort of general questions that people may have. And I'll start off with the first question. So who is eligible to be a part of the MAT Waiver Training?
Yeah.
And I know you, oh, go ahead, sorry.
Sure. The specific focus of this program is to train healthcare providers. So by healthcare providers, I mean professionals who have a medical or other healthcare professional license that allows them to prescribe under their own DEA number. So if you are a healthcare professional with your own DEA number, then you are eligible to take the waiver training and use the waiver training in your clinical setting. We are focused on training people in the greater Houston area. And so that's really our goal, is to increase local treatment resources. The training is free. So it doesn't cost you anything, and you do end up with 4 CMEs out of it. So that's a plus as well for folks that are looking to rack up their CME credits for their licensure and maintaining board certification.
Awesome. And another question that I had was, you mentioned that it's going to be a bit of a half and half training, virtual, and the other one, is it in person or is it all virtual as far as the MAT training overall?
Yeah, so the first 4 hours is virtual, very similar to this via Zoom, and but it will be live, so that people can ask questions, and it's very interactive. The second 4 hours is online, and that's asynchronous. People can do that at their leisure. Once they've finished the 4-hour training, we submit their name and email information to the online training folks, and they will get a link from the training organization so that they can access the online portion of the training. Once that's completed, then they'll get a certificate that allows them to apply for their waiver. And the training covers how to do that pretty nicely. And again, it's not a super complicated process. If it takes 10 minutes, that's taking a long time. It really just takes a couple minutes once you have your information gathered.
Okay, perfect. So that was the 2 main questions that I wanted to ask, and I did want to open this up again to anyone online and to you also, Dr. Kowalchuk, to see if there's any other sort of frequently asked questions that you may have heard from other professionals who may have kind of reached out to you.
Yeah, some of the things that I hear at trainings, people come to the training because they're curious about it, they're thinking about it, but they're really hesitant, to open up their practice to this. Are they going to have a flood of patients and just be known as the opiate use disorder treatment doc in their community or in their practice? And so I think it's important to highlight that you actually really can't be overwhelmed with patients with this waiver, because you're restricted to 30 active patients at any given time the first year you have your waiver. After that, if you choose to and you've reached your 30 patient limit, you can apply to the DEA again. It's very simple process that's completely online to increase the number of patients you can treat at any given time to 100. And after a year at 100, you can apply to go up as high as 275, but you can never go past that. And a lot of people who start using the waiver do so to help the people in their own practice. Maybe they have a patient with chronic pain that came to them, or that they started a long time ago before we had new recommendations that opiates aren't that great for chronic pain, but they're on it. They've had some issues with their opioid. Maybe they've sought an early refill on their prescription, or they've seen somebody else in between appointments and got an extra prescription. And so you're concerned, have they developed an opiate use disorder? You've tried to work with them to taper off. It really hasn't worked. This gives you another tool in your toolbox to help them. It is a partial opioid, the buprenorphine, so it can help somewhat with chronic pain for those that have both conditions, opiate use disorder and chronic pain. and really help them get off of their full opioid, which is a lot more risky than the buprenorphine. So again, it's not something where you have to overwhelm your practice with that. The other thing I always encourage people that are thinking about incorporating this into their practice, certainly you can do this on your own as the only physician in your practice if you're a solo practitioner, or if you're in a group practice and no one else really wants to go for this, you can do it. It's doable. My clinic within Harris Health at Ben Taub, outpatient clinics, I've been the sole provider since 2009, so over a decade. I've worked on my own with this, and it is doable. But I would say it's a little easier if you can have a partner, someone else in your practice who is also waivered. And again, you can share the 30 patients, et cetera, and it just gives you some backup with this, and someone to help go through this new process together.
Thank you so much for that. And I really do want to just again remind everyone that the training that we're going to be having, the overall training is going to be on Friday, September 18th. And if you're interested in registering, be sure to visit our website at www.doctorsforchange.org to learn more and to register. So I appreciate you, Dr. K, for joining us today. I also appreciate our audience joining us to listen in and to learn more about this opportunity. I want to open this up for any closing remarks. Appreciate you taking the time out to really dive deep into this topic and really providing the leadership in our community to help address this so that we can work together.
Thanks, Jorge. Yeah, a couple things. It is a 4-hour training. It's going to run 2 to 6 p.m. So you'll be home for dinner, so to speak. It's virtual, so you can already be home when you Zoom in for it. The other thing I wanted to highlight are two dates coming up in our community as well. Next Monday is National Opioid Overdose Awareness Day, and it's actually also International Opioid Overdose Awareness Day. So just something to put out there. We're really working hard in our community to help prevent opioid overdoses in a variety of ways. This is one way. Getting people linked to treatment, because the biggest risk factor for having an opiate overdose is actually having had a prior opioid overdose and just not getting effective care afterwards. But we're also trying to get naloxone and education on how to respond to an opiate overdose out into our communities. So I encourage everyone to be aware of opiate overdose risk in their patient population, and know that you can prescribe naloxone to anyone who is at risk themselves for an opiate overdose, or anyone who has a friend or family member who is at risk of opiate overdose can get naloxone. And if you don't feel like prescribing it to your patients for whatever reason, it is available by standing order through any pharmacy in the state of Texas. They don't have to come in with their own unique prescription. They can go to any pharmacy counter. They have to go to the pharmacist and request that and get that. And again, they don't have to themselves be at risk of an opioid overdose. If they have a friend or family member that they're concerned about, they can do that. And then the other thing I wanted to highlight was the Texas celebration for recovery. And that is going to be happening right alongside when we are having our training. So the 17th, 18th, and 19th. And that's going to be all virtual this year. So look out for that as well. And that's really a celebration of the recovery community across the state of Texas. Houston was supposed to host the National Rally for Recovery on the 19th of September. That obviously has been changed because of the pandemic, but we have 3 days worth of events coming up. So I encourage folks to check that out as well.
Absolutely, and we could do our best to really raise awareness on this and do what we can to promote the cause. So we'll be sure to follow us on social media as well at Doctors for Change, because we will be sharing these dates to help support this and raise awareness. Thank you for joining us. We'll go ahead and wrap up today's meeting, and I appreciate you all for being here today. Thank you so much.